and turn it over to Bonnie to start the presentation.
Great. Thank you, Jen, and welcome everyone. We appreciate you taking time out of what we know are really busy days and lives to join us at our Office of Community Living Priority Project Updates. This is really a continuation, if we can go to the next slide, of a informational memo that we sent out. If we could also put a link in the chat to that informational memo. Really wanted to create space to talk through. I think maybe that memo could get the award for the longest memo that my office has ever sent out. Really, the purpose of this webinar is to give an update on the key priority projects within the Office of Community Living and how they intersect in a coordinated effort. We know that over the past year that there has been some pretty significant pressure on the long-term services and support system in particular. Really the overlap of the end of the public health emergency, the transition of our case management agencies, and the launch of our new care and case management system have been hard on our community. We continue to work across our department to quickly resolve the ongoing challenges that have stemmed from those three things happening, really converging at the same time. We have heard you. We acknowledge that our partners are tired and that they need space and time to adapt to the changes that have already taken place. We also know that there are a number of exciting and long-awaited projects that stakeholders have been championing that are on the horizon. And so what I hope that you will hear in our next hour together is that we are trying to balance our commitment to our legislature and to our long-term vision of evolving our system to a more person-centered system that really better serves our members, their families, and our provider organizations that support them with while simultaneously working to slow down and be very intentional about any rollout of new work. With this in mind, you will see that we have narrowed our approach with the goal of easing any administrative demands on our key partners, especially case management agencies, and prioritizing really the initiatives that are most critical. Today, my team will provide an update on the plans that are related to our key priority projects that we have been discussing and working on for several years. We are eager to work with all of you on the rollout of the work that is before us around implementation. We will also be offering opportunities for how to get involved in this critical work. And as always, we welcome your feedback, any comments that you have on this proposed plan, and we'll be working closely with you as we move forward. I want to note that these are high-level timelines and deadlines, and as we are finalizing how we will be moving these forward, note that they might change slightly. We are currently working with our vendor partners to tighten them up and finalize these dates. So today it is a 70,000-foot view of our vision. And again, we will be welcoming your feedback, talking through your questions. What we don't answer in an individual way today, we will be gathering your questions and using those to inform our future individual engagement on the key issues, to inform our broader stakeholder communications. But really the goal is just to paint the vision today. With that, I'm going to keep us moving. And if we can go to the next slide, please. So the key priority projects, there's a lot of work happening within the Office of Community Living, but that were primarily impacted by the convergence of the end of the public health emergency, the launch of the care and case management system, and the transition to our new case management structure. Really has been our work to stabilize the system, which I'll talk about here shortly, the implementation of CFC, the implementation of our new single assessment tool and support plan, the decommissioning of the supports intensity scale, or the SIS, and the rollout, conversely, of our new skilled nursing assessor, the turning back on of the pediatric long-term home health PARs, or the prior authorization requests, and the Children with Complex Health Needs waiver, which is the merging of what was formerly known as the Children with Life-Limiting Illness waiver and the Children's HCBS waiver. So that's the new waiver that sort of those two are combined. So these are the key priority projects that we're going to be talking about today, the workarounds that we have in place. And again, our goal is to make sure that we are meeting our commitments to our members, that we're easing administrative burden, and that we're really keeping providers at the forefront and making sure that we have a stable system for them to operate in. Now, if we can go to the next slide, please. So with that in mind, looking at like stabilization, that's our foundation, that's our core. We really must make sure that as we're looking at how those issues have converged to impact long-term services and supports, we really have had an eagle eye, if you will, on member eligibility, provider payment, looking at case management agency response time to members. We have several efforts underway to ensure that we have that ongoing coverage for members, that we're doing our best to mitigate payment delays for LTSS providers, all with the goal at the end of the day to ensure that members can access much needed services. So I'm going to talk through, again, what are those strategies here in the coming slides. If you can go to the next slide, please. Okay, so at first we have protecting coverage for members, and that is our first strategy. And really what we have done is, once people are enrolled, there's several, I think, key things that we could do at a state level to make sure that while our county and case management agencies were doing their good work at the local level to achieve stability, that we could better ensure that coverage continued. So doing things like, making sure that we were extending the PARs, extending the level of care, making sure that, again, we could provide some flexibility for our case management agencies around how assessments could be provided for ongoing coverage for members. Again, making sure that if they are enrolled in services, that we could do the very, very best from a state level, take the actions to make sure that that coverage was maintained. We also went from looking at anybody over the last year that maybe had lost coverage. We did direct outreach to the tune of 3 times, reaching out to them to make sure that wasn't unintentional. And if they needed assistance enrolling back into long-term care, that we would provide that. We also looked at how we could pay providers timely to ensure access to services. So we did provisional payments initially, but then we also looked at, making sure that providers could bill off of a previous service plan if maybe the upcoming service plan wasn't already in place, and that as long as they were billing off of that previous service plan, that those claim edits would go through. So, putting some strategies in place that, again, made sure that access to services would be maintained. We are also working really closely with our IT vendors and our health information office to ensure that we are identifying as quickly as possible any IT issues with our care and case management system and resolving those and coming up with a strategic approach to make sure that our care and case management system is really getting to what we need it to be, and sort of mitigating the necessity for workarounds as quickly as possible. So we have a plan to sort of get it to where it needs to be. We have identified sort of the issues with that system, and have a sort of rolling release, if you will, to have those issues resolved. We are also working with our county and our case management agencies. There's a handful of them, primarily because of the unique issues and the urban areas mostly that have backlogs. So we are working with them to come up with strategies to support those backlog reduction plans. We are looking at having those backlogs remediated by the end of the year. And supporting them and making sure that those strategies are successful. And then, of course, addressing any appeals and escalation backlogs. So we have an escalation safety net at the state level, and also making sure that member appeal strategies remain in place, and that there isn't a backlog there, that people can leverage that strategy as well to ensure that, should they lose coverage, they can appeal and go through that process as well. So between these 5 areas, there is several buckets of work underneath. So again, I gave you just a high-level overview, but we have internally several teams working on each of these to make sure that we are really wrapping our arms holistically around the long-term services and support system. And this is not just within the Office of Community Living, but this is really across HCPF, certainly working hand in hand with our eligibility and policy and communications teams and our health information office teams to make sure that the long-term service and support system really remains at the center of our focus and our priority here at HCPF. We do have a stabilization page, if we can put that in the chat. If you're interested, we do have, we update communication around our efforts there. So if you are kind of wondering where things are at, I would encourage you to go there. I think we are due for an update here in the coming weeks. Also have links to our escalation page. If you are in need of some support and help, you can also go there to find the links. Now, I am going to hand it over to Lana, who is going to give an update on our work to implement Community First Choice. That is one of the initiatives we have prioritized moving forward with. And I think we have a strategy to make sure, again, that it is in the I think most effective way possible, in a way that sort of mitigates any administrative strain on our local partners. Lana?
Thank you, Bonnie. Good morning. My name is Lana Eggers, and I manage the Waiver Innovation and Compliance section here at the department. And I'll be presenting on 2 different initiatives today. So first, I'll go over Community First Choice, and then you'll still have me to talk through the new merged children's waiver. So Community First Choice is truly a transformational project. The department has been working to implement Community First Choice in Colorado for about 10 years now. And in the last couple years, we've really hit the ground running to get this program off the ground. So what is CFC? CFC is also known as a 1915K. It's an optional state plan Medicaid program that allows states to offer select home and community-based services that are traditionally offered through our 1915C waivers into our state plans. And with that expansion, with that transition, it expands these long-term care services to more Health First Colorado members. Next slide, please. So our goal here at the department is to implement Community First Choice by July 1st, 2025. That work is well underway. We have a Community First Choice Council, and we'd be happy to have anybody join that council to learn more, since we are really hitting this program at the high level today. We also have a website here at the bottom if you'd like to learn more than I'm presenting today on CFC. But as I mentioned, CFC expands access to home and community-based services across the state. Most notably, it expands access to consumer-directed options. So think services like consumer-directed attendant support services or in-home support services. Those services are traditionally offered through our waivers and are only available to select members who are enrolled in the waiver that has those services. So with Community First Choice, those services will be expanded statewide to any member who meets an institutional level of care and has an assessed need for those services. Excitingly, that also includes an expansion for children for these consumer-directed services. We received legislative approval to move forward with Community First Choice in 2023 through Senate Bill 23289. And in addition to expanding services, Community First Choice also offers an enhanced 50% FMAP. So what that means is that currently the federal government pays about 50% of our waiver services. For states who have opted to provide those same services through the Community First Choice option, the federal government is incentivizing states to expand and is now providing an extra 6%. So we do expect that CFC will help save money in Colorado. Next slide, please. So like I said, we've been working on Community First Choice for some time now. Our original goal was to implement CFC using certain parts of the care and case management system. You know, there's a lot of exciting work going on in Colorado around improving and implementing new programs. So our initial intention was to use the Colorado Single Assessment and the Person-Centered Support Plan for eligibility determination and service planning. We also intended to use the Person-Centered Budget Algorithm, sometimes known as the PCBA, to determine budgets for both CFC and our HCBS waiver services. However, LTSS stabilization has impacted the availability of those tools, and they won't be functional to the point that we need them to be by the launch of CFC in July 1st, 2025. With Community First Choice, we do need to make a lot of systems edits to make sure that our systems can handle this program expansion. And that's a lot of legwork, it's a lot of background work that just truly does take time to make sure that we get it right. So from the state level, we decided that it would be most important that we relied on systems that we knew would be functional, that we knew would serve the purpose that they needed to in order to get CFC off the ground on time. So in this next slide, I'd like to present a proposal that we're bringing to stakeholders around our transition or a pivot from this plan. Next slide, please. So given our current challenges with LTSS stabilization, what HCPF proposes is that we continue to utilize the ULTC 100.2 for eligibility assessments and for current service planning under both CFC and HCBS waivers. There is a small carve out in that proposal for newly enrolling members in the supported living services waiver and the developmental disabilities waiver, which my colleague Rayanne will talk about in a few moments here. And we're also proposing that we utilize a modified task worksheet. So members and providers and families who are familiar with some of our self-directed programs might be familiar with this task worksheet. And we're proposing that we implement a modified version of that to be used for all CFC personal care and homemaker services. That would include our consumer-directed attendant support services, our in-home support services, and agency-based service delivery options for both adults and children. Next slide, please. So this presentation today discusses a lot of intersecting initiatives. So all of the things on this screen we're going to go to in more detail, but I just really want to call out that Community First Choice does have large implications across many of the different systems here in Colorado. And the 3 bullet points on the screen have a big touch point with Community First Choice. So first, it's the implementation of the Children's Complex Health Needs Waiver, which I'll talk about in just a few minutes here. And next, it's pediatric long-term home health PARs. So with the implementation of Community First Choice, we're continuing to move forward with current efforts to reinstate pediatric long-term home health prior authorization requests. This will ensure that authorized skilled services are medically necessary and that members receive services that most align with their needs. And we'll also be implementing the skilled nurse assessor. So that planned nurse assessor is to complete a skilled care acuity assessment prior to the authorization of long-term home health, private duty nursing, and health maintenance activities. And my colleague Candace will talk a little bit more about that later, but one of the reasons that that's so important for Community First Choice is we will have the expansion of health maintenance activities into the state plan. So there will be more options for skilled care and we want to make sure that members have access to the services that best suit their needs. Next slide, please. So I'm going to briefly go over the Children with Complex Health Needs waiver. So as Bonnie mentioned earlier, this initiative merges two of our children's waivers. This merges the Children with Life-Limiting Illness waiver and the Children's Home and Community-Based Services waiver into a new waiver titled the Complex Health Needs Waiver, Children with Complex Health Needs Waiver. It's a little bit of a mouthful. We're working with the acronym CWCHN on this one. So this waiver will increase access to needed services. So for example, respite is not currently a service that's offered under the CHCBS waiver, but now members who are on the CHCBS waiver will transition and have access to service expansion for services like respite. Next slide, please. So we've been working on this project for a few months now. So back in July of this year, the case management benefit moved out of the CHCBS waiver. So historically, that had been billed as a service, and now it has transitioned into a, oh, I think we might have skipped ahead just one slide here. And that has transitioned into an administrative activity. So it's billed administratively instead of that service. And because we recognize that some members currently on the CHCBS waiver only access the case management benefit, prior to that change in July, we added a new wellness education benefit to the CHCBS waiver. So beginning May 1st of this year, members began to receive an educational mailing or an educational material sent to their home to provide tips and tools on health-related topics, and that also helped members maintain eligibility for CHCBS during this transitional period of the waiver. So looking forward, next summer, to align with the implementation of CFC, so July 1st, 2025, the CHCBS waiver will merge with the CLLI waiver, the Children with Life-Limiting Illness waiver, and it will be renamed the Children with Complex Health Needs waiver. I'm still working on that one. And with that merger, we're going to expand eligibility criteria to ensure that all members who are eligible for the CHCBS waiver and members who are eligible for the CLLI waiver will have access to this new CWCHN waiver. So this transition will take about a year, beginning in summer of 2025. At time of continued stay review, a member, when they go through their assessment process, will be authorized into the new CWCHN waiver. At that time, members will also be authorized services under Community First Choice if those services meet their needs. So for example, if a member is on the CHCBS waiver and they're receiving health maintenance activities, they will transition over to the CWCHN waiver, in which they'll have access to some benefit expansion. And then also they'll maintain access to health maintenance activities, but this time there'll be access through Community First Choice. From a member level, it won't look any different. The service is remaining the same, except for now that same child might have access to consumer-directed attendance support services, and maybe that better suits their needs. And then at the end of that year transition, the department will be requesting to conclude that waiver, and we'll terminate that waiver with the Centers for Medicare and Medicaid Services once we've confirmed that all members have transitioned accordingly. So that's the overview of that project. I believe I'm passing off to my colleague, Ryan Lubitz, who has some exciting slides on case management. Thank you.
Thank you, Lana. Lots of great information there. Ryan Lubitz with Office of Community Living Case Management Quality Performance Division. I'm going to walk you through some important information today regarding the Colorado Single Assessment, or CSA, the Person-Centered Support Plan, or PCSP, and the Supports Intensity Scale, or SIS, decommission. So for a little historical background, Senate Bill 16192 directed the department to create a single assessment for all programs. The department worked collaboratively with a group of stakeholders over several years to develop new processes for functional eligibility determinations, needs assessments, and support planning for all individuals seeking or receiving long-term services and supports, resulting in the Colorado Single Assessment and Person-Centered Support Plan, or as the CSA and PCSP that I referenced above. So the new processes are person-centered, they enhance self-direction and facilitate greater coordination of services. They are equally applicable to adults and children with disabilities. For those of you that have contributed to the development of these new processes, thank you for your time and dedication, as it truly has been years of work collaboratively in the making. Next slide, please. Okay, so as we work to implement the Colorado Single Assessment and Person-Centered Support Plan, we recognize that we need to be thoughtful and measured in our approach during this time of great change for our case management agencies and our members. To that end, we're looking to roll out the Colorado Single Assessment and Person-Centered Support Plan in a limited strategic manner for members utilizing our adult intellectual and developmental disability waivers for our new enrollments and at members' annual reassessment and service planning meetings. In doing this, we can be strategic and targeted in our training approach to case managers that primarily specialize in supporting members with intellectual and developmental disabilities. We can work through any challenges as they arise, and we can apply lessons learned to the broader populations as necessary. The timeline for the full-scale implementation of the new assessment and person-centered support plan is yet to be determined, and it really is dependent on the stabilization of the initial rollout. We're going to continue using our existing systems, so the Care and Case Management System, so CCM, and the existing prior authorization requests, or PAR processes that are in our Bridge system. And then finally, we're going to discontinue the use of the Service Plan Authorization Limit, or SPAL, and utilize the same processes for HCBS supported living services, as well as all other waiver participants to enroll in dual CFC HCBS services. Next slide, please. Lots of information, lots of acronyms, so thanks for bearing with me on that slide. All right. So as we're making these changes, they will allow us to and require us to decommission the supports intensity scale in Colorado. So the supports intensity scale, or SIS, version that Colorado uses is being discontinued by our national partner and will no longer be available for use after July 1st, 2025. I also want to clarify that along with no longer using that support intensity scale, or SIS, the existing 100.2 assessment will also no longer be used for members with for our adult members with intellectual and developmental disabilities, as our new Colorado Single Assessment tool will be used instead. So for all adult waivers with individuals with intellectual and developmental disabilities. In looking at the current ecosystem, we plan to maintain as many existing processes as possible so as to minimize the workload demands for our case management agencies and really maintain consistency for the members' experience. So the limited rollout of the Colorado Single Assessment for adults with intellectual and developmental disabilities will be a measured way to slowly implement the new assessment and person-centered support planning process, and it will enable HCPF overall to closely monitor the results, especially Office of Community Living, because the interim Colorado Single Assessment and Support Level process will be used for newly enrolling adult intellectual and developmental disability members. We will be able to conduct comparative analysis with existing enrollees who will also receive the Colorado Single Assessment, but who already have an established level. That was a lot of information. So we're going to continue the use of the established CIS support levels for currently enrolled IDD waiver members at their continued stay review, or CSR, sometimes it's called, or annual service plan meetings. There'll be no changes to member service levels. We will continue the use of existing exceptions processes, so support level reviews, for currently enrolled IDD members who have needs beyond what are captured in the established CIS support level. We will delay the person-centered budget algorithm until after Community First Choice launches. The Colorado Single Assessment has been fully implemented for all waiver programs, and we really make sure that we have sufficient data that has been gathered to develop and evaluate the person-centered budget algorithm within the confines of our Community First Choice program. Okay, let's go to next slide, please. As we look ahead and move forward, Office of Community Living will collaborate with our stakeholders in the coming months to work through the approach. The proposed CSA transition plan, or Colorado Single Assessment Transition Plan, to decommission the CIS assessment by July 1st, 2025. So we'll be working with our stakeholders on that, as well as the proposed interim Colorado Single Assessment Support Level Strategy for residential and day habilitation services for newly enrolling members with intellectual and developmental disabilities who are not accessing Community First Choice for those HCBS waiver services. This is a necessary step in the transition away from the supports intensity scale and will be the stepping stone towards the final approach with the PCBA in the future. The plan for targeted training for case management agencies in the limited rollout of the CSA and PCSP person-centered support plan in the care and case management system will also be part of that engagement. We currently have engaged with a work group of very invested stakeholders, as I referenced when I started my portion of this slide deck, over many years, who have been really an integral part of the development of the Colorado Single Assessment and Person-Centered Support Plan. And this group continues to provide input to us regarding the decommissioning of the CIS, the rules that we're putting through Medical Services Board, our training, best practices, ideas for the rollout, the limited rollout of these new assessments and processes in our systems. So that is our update. Here, I'm going to turn it over to Candace on the skilled nurse assessor.
Thank you, Ryan. I appreciate it. Great update, and good morning, everybody. My name is Candace Bailey, and I am the HCBS Division Director within the Office of Community Living. And I get to talk to you all today about our new initiative, the Skilled Nurse Assessor. So really, what is the Skilled Nurse Assessor? This was a budget request that was approved last session to implement what is called a third-party nurse assessor. And this is a process that will streamline the way that members are assessed and receive a recommendation for skilled care services. So what this means is that instead of going through 3 different assessments for perhaps private duty nursing, long-term home health, and then health maintenance activities, a member could actually receive 1 single assessment to determine the appropriate level of their skilled care needs, and then also provide education to help members understand the various ways that folks can receive those services. Next slide, please. Thank you. All right, so some updates and looking forward. We actually, since this was just authorized in this past session, we started work on this initiative this summer. We are working on and finalizing a request for proposal, or an RFP, to solicit a single vendor that would be interested in conducting the work on behalf of HCPUF. We are anticipating the RFP to be posted this fall, which is really exciting. As folks usually know, we actually can have limited stakeholder engagement during the time that the RFP is posted, so during the process itself. And so wanted to get this information in front of you all now before it's posted. It will be posted publicly. And then we are anticipating phasing this in at the same time as we phase in the pediatric long-term home health PARs, so that we can work on that process and have it all roll out smoothly together at the same time. And then the nurse assessor will be utilizing the newly developed skilled care acuity assessment that will help determine the level and hours of skilled care needs. And so all of this to make sure that folks can really receive the appropriate level of services, the appropriate level of care, and information around where they can receive that skilled care. So another really big component of this that isn't stated here is this nurse assessor will actually be providing education to each of the members. So for example, they will be able to educate an individual to know that self-direction is an option for them, should they like to pursue that. Okay, and the next slide, please. All right, so just as a final note here, the assessment tool was part of the ARPA project, Home Health PDN Acuity Tool. This is going to be used to better determine the appropriate medical necessity level of care ahead of time. It's a validated norm referenced assessment that we were able to obtain, which is really exciting. And then we will also be hosting additional stakeholder opportunities and information around these tools. More to come on that, but it is another really exciting piece and component of this. Next slide, please. Thank you, Haley, for posting that. And then in this slightly different topic, but all related, obviously, the Pediatric Long-Term Home Health Prior Authorization Restart, PAR Restart. The PAR process allows HCPF to demonstrate our statewide surveillance and utilization review that actually meets all of the federal requirements that we have here. The Pediatric Long-Term Home Health PARs were paused during the pandemic and then remained paused during the maintenance of effort period for ARPA. And so the goal here is to restart those once that maintenance of effort period is lifted. Next slide, please. And then here's a little bit of a timeline and a little bit of looking forward for you all as far as how this process is going to work. The PARs were paused back in July 1st, 2020. We turned them on briefly back in November 1st, 2021, and then paused them again in February, and they have remained off since, so that we could get through this maintenance of effort process. To go forward, we actually have hosted a couple of restart work groups to discuss kind of the process, the phasing, what it should look like, how do we do this, how do we roll it out, how do we turn this back on after so many years of it being off, without doing it all at once and the system completely collapsing underneath doing 14,000 PARs at one time. And so the first meeting was on May 8th, and the second meeting was on September 11th. Those meetings and the slide decks and everything are posted online. They are on our website, our long-term home health website, that you all can see and review and reach out if you have any questions. And then we are finalizing the timeline for the PAR resumption, and we will have those released very, very soon so that everybody can start to prepare very soon for the restart, which will occur next year. So we're not going to release it for this month, starting next month. It is going to be at least a 6-month notice so that everybody can prepare and be ready. We can provide training to our providers. We can provide webinars, all of the things that are going to be necessary. And from here, I am turning it back over to Bonnie, I believe.
Great, thank you, Candace. I appreciate it. If we can go to the next slide, please. All right, so I think I saw a request for a timeline or a roadmap, and so ask and you shall receive. So here we go. So we covered a lot of text, Lori, as you noted, I think in your question. I also just maybe want to highlight that, somebody else asked, hey, why aren't the questions visible? For those of you that joined OCL along our, I think, COVID days and maybe the few years that followed, we used to do webinars all of the time. And we really strive to be as transparent as possible. But what we now know is that it's really hard to stop people from posting PHI in the chat. And when that happens, then we can't post the webinars. And so we really want to record this webinar. We want to make it publicly available, that not everybody can always attend. And so this is just one way for us to make sure that as we're recording these, that, we can go ahead and post these as quickly as possible. So we are taking all of the questions, we are compiling them, and again, we'll use them to inform our communications and get those out. So going over our chat, if you will, our timeline here, you can see, I think that the biggest action that we have that's forthcoming is submitting our state plan amendment for CFC. That work has perhaps been the most long-standing. We have been working on that for well over a decade, and so we are slated this month to submit that to CMS for their consideration. So that is and what has been, I think, a lot of hard work, something that we are very excited about moving forward. And then also this fall, as Candace had mentioned, we are looking at the request for proposal, posting that for that nurse assessor. So those are the things that are, I think, most immediate in terms of moving forward these intersecting initiatives. We also are looking to combine and again, make as easy as possible training for our case manager on all of our initiatives. So our team is, if you will, frantically working behind the curtain for, I think, this spring, looking at our training for our case managers on the things that we are deciding to move forward with, how we can do that in the most effective and efficient way possible. So we're looking between February and April, what does training for case managers look like for them? How do we do that in the most, again, least burdensome way possible, but also really make sure they have the tools to implement the things that we are moving forward with. And so we know that we have that launch date of July 1st, 2025, right? So we have CFC launching on July 1st. To do that, we're merging the CLLI and the CHCBS waivers into that Children's with Complex Health Needs waiver. We are implementing the new single assessment for all adult members that are enrolling into the SLS and the DD waivers, and we are decommissioning the CIS. So all of that is happening July 1st, again, in a very measured way. So we are teeing that up for that July 1st implementation. In advance of that, in the spring, we will have the nurse assessor contract awarded, and we will have rules for CFC and the new waiver done. You can see my mind works a little bit differently, and I'm sort of moving back up that timeline. So I'm sorry if I'm making anybody's head explode on this webinar. And then you can see post that July 1st, right? We are making sure that we have good safety nets and escalation processes in place. And, you know, one of the things that, you know, we have done over this past year is a lot of dissecting and lessons learned from what didn't go well, so that as we're looking at implementation moving forward and change management, how do we make sure that we understand really quickly where we might need to pivot or tweak our implementation to mitigate our approach as quickly as possible to make sure that things, you know, move over any bumps that might be experienced and smooth that out as quickly as possible. So we will have processes in place for all of these initiatives that help us understand maybe where there's a bump that we didn't anticipate, and processes to, again, smooth those out as quickly as possible. If we can go to the next slide, please. So I also, again, as I'm going to sort of end where I started, I think it's very important to note that, you know, our goal here was to paint the vision for, you know, understanding that our care and case management system still has some mitigation that needs to happen, understanding that our system still needs to stabilize, and we really need to make sure that our case management agencies and case managers and providers and members are feeling supported. You know, we want to move forward in a measured way, but the deep work to do this sort of pivoting is happening in other areas. So there's some opportunities to engage. We have the Community First Council. There's a link there. This will be dropped in the chat. The Children's Disability Advisory Committee. There's an opportunity to engage there, and the long-term home health stakeholder engagement. There's an opportunity to engage there on some of this work. I want to also note that all announcements will be made through our OCL Digest, and we also have a stakeholder engagement calendar that you can plug in to additional engagement opportunities there. So we have other opportunities, I think, for this work to be highlighted. I am just going to go back to the Q&A and just if we can go to the questions section and just to highlight a few to be answered verbally there where I saw some themes, if that's all right. And so, Lana, I'm going to first call on you. One of the themes that I saw was really folks trying to understand really the comparison and contrasting between CFC and, for example, like EBD services. How would Medicaid members know what waiver they're eligible for them to make an educated choice around, do I want to have CFC services or do I want to go into EBD? And can you maybe give a little bit more information for the people on this webinar to help them understand that?
Yes, absolutely. And that's a great question. So with the implementation of Community First Choice, some of these waiver services are moving into CFC. So some examples of that would be personal care, homemaker, health maintenance, and select other services. Our link will kind of give you the overall scope of services, but those services going forward will only be available in Community First Choice. So what we do expect is that members who access a variety of waiver services will continue to be on their waiver. So for example, you might have an individual who receives supported employment. They might stay on their waiver so they could have continued access to that benefit, but then they'll be accessing health maintenance and personal care over in Community First Choice. So it's not an either or type situation. Any member who is eligible for a waiver and enrolled on a waiver automatically has access to services on Community First Choice that they have an assessed need for. So we really do see these two programs intertwining very fluidly with each other. I believe we will be posting a link in the Q&A that has a nice comparison chart that shows which services will remain in the waivers and who would be eligible for those waivers, and then also the services moving to Community First Choice and who would be eligible for those.
Thank you for that, Lana. I really appreciate that. I think the next question I want to ask is of Candace. Candace, can you share how and when the skilled nurse assessment will be shared with families and advocates?
Absolutely. Thank you, Bonnie. So we are finalizing and finishing up our contract right now with our vendor UMass who created the assessment. We are hoping to have that out and engage with folks in the next couple of months, actually. Probably not over the holidays, but so we'll work around all of that. But we really hope to have it out here, and like I said, in the next month or two. And it will be posted so everybody will have access to it and be able to see it and all of the things.
Thank you. I appreciate that. I think the next question is for Ryan, related to, and it might be Ryan or it might be Lana. So either one of you can chime in. When will the modified CDAS task worksheet be available to be reviewed by the community? And really, what major changes shall the community anticipate?
Hi. So the task worksheet, we are currently developing a draft of this, and it will be coming to stakeholders in the coming months. So I believe some information is posted on our external website, and I'm wondering if we can have one of our colleagues here grab some information and provide it to stakeholders on the newly drafted task worksheet. And those initiatives and that stakeholder engagement is being managed by Cassandra Keller and Candace Bailey, and folks will definitely be engaged in that in the next couple of months.
And Bonnie, I'm happy to jump in if that's helpful.
Yeah,
we actually have a meeting scheduled for October 30th to share the task worksheet and go over that with everybody. Really focusing in on the norms and how it was developed. But that meeting is currently scheduled for October 30th.
Great. Thank you. I really appreciate that. Also, I think the next question would be for Ryan. When will that new CSA begin to be piloted?
Thank you. So right now we're still working through the timeline on the training and the pilot and the full launch of the CSA for individuals that are adults with intellectual and developmental disabilities. So we do have some stakeholder engagement work that we need to do before we can solidify that timeline to ensure that we have all of our processes that I went through today completely aligned. And so we'll share it as soon as we have that information, but I don't have a definitive date for you at this time.
I think these are great questions. Again, I'm trying to look for themes in real time. I am wondering if we could speak to again, maybe if this is for you, Candace, if somebody has a skilled care assessment where this fits into like the new skilled nursing assessment, maybe where this fits into the process of somebody who has an intellectual and developmental disability, where that would fit into them entering into the system. And then maybe if you can, for me, this is me adding into the question, sorry, ad hoc, answer it from the perspective of a person with IDD, but really anybody entering the system. So where does that skilled nursing assessors kind of fit in the ecosystem of somebody accessing long-term care?
Sure. Thank you, Bonnie. So really, it's going to fit in when there's an identified need for skilled care. So if an individual is, maybe they're meeting with their case manager and their case manager says, wow, that sure sounds like your assistance with transfers is pretty skilled. And when they would normally make a referral to a long-term home health agency, they would make a referral to the skilled assessor. The referral could come from a hospital. So it's really at any point that an individual has need for skilled care services. So if an individual is on the DD waiver and they have a need for, let's say, a nurse, a private duty nurse, or just an intermittent nurse, they could also receive those, but they would have to be assessed by this assessor as well to help determine the level and the hours of that need, and then make sure that the member understands what their needs are and their options for receiving those services. So it's really going to be on the front end of receiving those skilled care services is when that assessment occurs, and then the recommendation will go forward.
That is great. I really appreciate it. Ken, I really appreciate the time that you all have chosen to spend with us today. I think we have a list of really great questions. Again, our goal is to compile those, use those to inform our communications around these intersecting timelines. We really are doing our best to answer people individually. Again, it's really a PHI concern, and we will certainly use it to answer our questions moving forward. We will be sending out opportunities to engage on all of these initiatives going forward. Really, your expertise and insight help us collectively be better at all of the work that we are doing. And please know that it is welcomed and appreciated. And our goal is to move the key work forward, especially the work that will alleviate, I think, struggles for members, their families, providers, case management agencies, while also, of course, easing any administrative burden. So thank you for your time today. We hope that this high-level vision painting, if you will, provides clarity on how we're moving this work forward. And gives you the clarity that you're seeking. We welcome any feedback that you have post this webinar. Please continue to engage, to reach out, to offer us any questions or feedback that you have. And with that, stay in touch and look forward to working directly with all of you. So take care.